Timberly Shepard with Veterans Affairs for the Finger Lakes region says the pandemic has definitely played a role in recent shortages.
Childcare was an issue, school was an issue, so people really had to kind of change their lives to really meet the needs of themselves and their families.
Nurses are especially needed in their assisted living homes. It's a shortage she says was bound to happen with the baby boomer generation growing older. The pandemic is exacerbating it.
There's over 1 million nurses who are older than 50 years old. So that means within the next 10 to 15 years, 1/3 of our workforce is going to just disappear.
Deborah Stamps is a nurse with Rochester Regional Health, also experiencing this shortage. She says another major contributing factor to it is the burnout.
Because of just the stress of caring for very, very, very sick people.
She says staff feel the effect of this shortage. 12-hour shifts can turn into 14 or 16 hours.
They get emotionally and just physically exhausted. You know, when you think about caring for very, very sick people, not only the shortage of nursing personnel, but also some of the support services. So, you know, maybe you don't have a receptionist to answer the telephone.
Stamps says at Rochester Regional Health, they've been working on growing a pipeline for nurses through the Isabella Graham Hart School of Nursing, which has recently expanded. As for the VA of Finger Lakes, they say a year-long orientation program to help transition recent grads into the practice is helping with retention and better mental health. Reporting, Erica Cost, News 8.
Erica, thank you.